Assalamu alaikum, this is Alex from Apocalypse.Intelligence, and we are starting with scrubbing in because we are doing more kittens today. I am putting on gloves, however, it is still important to maintain sanitary conditions. So, make sure you get under the nails. Notice I took off my nail polish from the other day. So I usually go up about as far as you do for wudu for the Muslims, and don't mind my tattoos. I was a little bit estranged from religion at that time. Well, religion I am presently, at least. So the goal is not to burn myself out. I try to get about 5 or 6 kittens done a day, and do the best that I can do, realizing that doing anything at all is better than doing nothing. So sometimes blowing into your gloves a little bit helps get them on. And once again, I forgot hand lotion, which makes this process a lot easier. Just because I'm in intelligence, it doesn't mean that I'm intelligent. Anyway, so we are going to continue to their kitten room. So we have a warm cup of water right here. We have empty cup. I'm going to be putting all the excess thingamabobs. We're going to grab some of these, this, and then I have more stuff in the bathroom. So I'm going to take you over. I'm going to let you look at the kittens for a bit, because I apparently have 18 minutes to play with you. Excellent. This is completely unscripted, of course. So we're going to turn around and we're going to look at the kittens. Look at all these kittens. So I'm going to leave you to babysit. Hello, Mama. And I'm going to go and get the rest of the supplies. So enjoy some very pleasant cat time. Ew. Hello, darlings. I think we can put this up here. And this as well, so it stays a little bit cleaner. Okay, I'll be right back. Assalamu alaikum. Hello, babies. Okay, so I've returned with saline solution, blanket to sit on. Hello, little one. I have returned. The great Sufi monster has returned. Okay, so anyway, babies, it's me. Oh, you are looking so much better. You're doing a great job, Mama. So, bring this down. Bring this down. Ow, 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 ow. 44 years old. Ow. Okay. So, you try to cut, they try to mise en place, so to speak, first. Put the towel down over. And of course, we take volunteers first. So, the kittens that come towards me. Oh my goodness, little sneezy. Cotton swabs. We have a kitten holding pen over to the side here. And we are going to remove this one up here. Hello. And we are going to switch to something that makes a little bit more sense. Oh boy. So, we're going to take these babies one by one and do our best today. So, I kind of look like the scarecrow with this hat. My hair is actually very nice underneath. But, yeah. Okay. So. Rah. Okay. Hi. So we're going to introduce some cats. We have this one, which is a little Himalayan guy. Meow. 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 What? Do you want to? Meow. Oh my god, so much to say. Look at how fat the belly is. Look at how good these mothers are. Amazing. This guy takes such good care of these cats. He's basically like a monk. So he's kind of half Buddhist, half Catholic. So back, you guys in Pennsylvania, think like Prairie Donald St. John, but a little bit younger and into radio. So this one. So this is Little Mango from yesterday. He's obviously much improved. So once you unseal their eyeballs, they kind of stay unsealed, which is excellent. So that means they're nice and healthy and can rebound nice and fast. So just a little bit of intervention. So we're gonna look at this guy. Oh, we have our first contestant for eyeball release. Oh my goodness. Okay, so I have to show you one thing though. Little Mango is being very mango. We are not going to let him continue with the eating of the plastic. Okay. Okay. So you kind of learn as you go. I've been doing this off and on for years. So there's been phases in my life where I've been doing it nonstop every single day for weeks at a time, and then long years, over a decade where I've never done it at all. So, my goodness. You can tell that I'm getting ambushed. This is an adorable army of chaos. And this is basically a big, in Islam we would call it baraka, blessing after a very stressful several months. I seem to have this repetitive pattern in life that I go through something incredibly stressful or a long project or whatever. And then the very next phase of life is me being surrounded by kittens. I don't know how I'm going to get anything done here. Okay. So we're going to take this little patient guy, and I want you to look close. So this guy is actually an active infection. So we are going to have to be extra, extra careful with his eyeballs. So we hold him against the heart. Okay. So he wants to be comforted. And he needs to be comforted. Oh, we're going to have to soak for him. So method for this guy, because he is just so crusty, is we're going to have to soak a pad in warm water and then put it directly over the eyeball. So, and then we're going to do the medication directly after. So, I'm trying to keep him out of the way of his brothers and sisters. And it's amazing, actually, that a lot of these cats are male. And that I've noticed. This one is... Correction. I think this is a little girl. So, okay. You are going to squirm. And I am going to... Ya Shafi anta al Shafi, ya Kafi anta al Kafi. So, prayer is a form of resonance. Okay, this is not some crazy schizo nonsense. So, whatever language you pray in, as long as it's for benevolent intent, it creates a resonance frequency that is beneficial. They've proven this through various religions, and everybody's like, oh, my religion does this superior or whatever. Oh my goodness. Oh, goodness gracious. Okay. So you have to take the squirming into account. Okay. This guy's got little white finger mittens. So each kitten has their own comfort thing. Some want to be up against the heart. Some want to be down on the ground. Some kind of have more of an acclimation towards vertical versus horizontal. You can't just do the same for every single cat. It's really not oh, goodness gracious. Okay, so his eye is juicy, and that's not a good thing. So a juicy eye does not mean that it's necessarily unsavable, but it does make things a little bit less. I know it's uncomfortable, sweetie, but until I get all that gook out. Oh, you notice how absolutely non-violent these cats are. Like, not at all. Just, so I'm going to pre-prepare a pad. I'll use the other side of this one here with the saline. And let's go. Okay, so. Oh, wheeze. Oh, wheeze. Oh, I know. Okay, I know. Here, let me support your little butt. Okay, so we go to the side. Always wipe away from the nose. And give the kitten a little bit of freedom, okay? So if he has a little bit of agency, as long as he's not hurting, if he has a little bit of control over his own treatment, you know, they're just little beings, you know? Oh, there's kittens fighting in the corner. Okay, so we have the saline solution. Little Velcro. Okay, so I don't like scruffing cats, but if I'm going to do it, very gently, like a massage, okay? So like that, okay? Not like grabbing, okay? I've seen some veterinarians have been incredibly harsh with scruffing, especially when giving pills, but we're not giving a pill here. We're fixing an eyeball, and that's very delicate work. So you don't want to accidentally put too much pressure. Now, this one is mostly liquid mucus, so that's why I'm not using the Q-tips. Okay. Sometimes imitating their little noises back at them, it's not just amusing, but it's kind of a comfort thing. So, for them and for me. This is a little bit of traumatizing work. So we're going to take a look at the eyes now. We're going to, okay, so we're going to see wide, I don't open, gentle, gentle. Okay, so, other side of the cloth, more saline solution onto the dry side. I accidentally grabbed 2 cloths at once, but, you know, fantastic. Okay, so, no, okay, Prince nonsense. Okay, so, there is, ooh, okay. Unfortunately, I am going to have to violate your autonomy slightly, madam. Okay, so, thank you for opening your eyeball so I can get this out. Yes, I know, meep. Okay, so you notice I flipped it over? Okay, and okay. You want to kind of imitate the mother. You don't want to go, remember that the mom's got a barbed tongue. You know, it's not silky smooth. But it's, so we rotate the cloth. And then we try again. Okay, so. Meep. Okay, I know. Give me your eye. Okay. So we don't want to force it. That might be as good as we can do today. I'm not going to force the eye open. It is too swollen. So as soon as I get that cream that I have listed below, I'm not going to mispronounce it and have you guys. I'll try and point at it. That's what you need to get right there. I've never inserted a word in a video before, so if I'm successful, give me a thumbs up. Okay, so we are going to grab another kitten. So we're going to decrust his eye. So this is a repeat offender. This is a little Bird here. Obviously we have to call him Bird because he's the first gray and white that we have. I didn't name him yesterday because you didn't see him on camera. So, are you going to complain today? Probably. So again, I am not a veterinarian. I am a long-term volunteer at veterinary clinics, and I've worked as a vet tech off and on and volunteered in capacities as such. Okay. Come on, Bird. Wouldn't it be funny if you're a girl? I bet you're a girl. Okay. Okay, so we're going to try the scruff method because Bird complains. So, Bird, you notice the only way to get Bird to cooperate. Oh, Oh, yeah, just like your name said. Uh-huh. How dare I? Yep. You can almost hear him complaining about Chicago. I have a very good or bad habit of naming cats after people's nicknames. So, in this case, it's an LRF character. So, we are going to do saline now. There you go. And if the video runs out, I apologize. So, yeah, Sheffy until Sheffy, yeah, Keffy until Keffy. Yes, I know. Do you want me to do Rukia on you next? A little exorcism? Oh, no. Okay.